Hey everyone, we've got another specimen today. This is number 1617 in our collection. And we'll start off with a little teaser just to kind of highlight the main feature we'll be discussing today. So we're going to go straight to the posterior aspect of this heart. We're going to go right to the left atrium. And when we look inside this left atrium, we find that there's an interatrial communication here that spans a large portion of the atrium. This has been patched surgically, and we find that it does course quite inferiorly and that it's very close to the right pulmonary veins. So here's the right lung, here's the right pulmonary veins, and here's the margin of the patch of this intraatrial communication. So this in fact is an inferior sinus venosus interatrial communication. Purposely calling this an interatrial communication and not a true atrial septal defect. But we'll get to that in a little bit. So now let's go ahead and place the heart as it would sit in the chest and just quickly get our bearings. We do see that the lungs are still attached, and here's the left lung, here's the right lung, and the trachea is still attached as well. And you can see down the airway here, there's the epiglottis. Anterior surface of the heart coming out towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior here, and once again left here, right here. So let's start off as I like to, which is by identifying the right atrial appendage, at least externally. And here we find an atrial appendage that's triangular in shape, broad-based or pyramidal. And we also see that it's got some sutures thrown in it from a previous repair. So all the morphologic features consistent, at least externally, with a morphologic right atrial appendage. So why don't we go ahead and open up the heart there. And when we do that, we do find that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We also find the superior caval vein that drains normally, in usual fashion, to the roof of the morphologic right atrium. Now, when we look at this right atrium, we do find that there's a large interatrial communication here. We do see evidence of suture line here, and this is patch material of some variety. So there is some sort of an interatrial communication here. We see the superior caval vein, and we do see that this interatrial communication is a little removed from that. But the superior caval vein would have drained into the heart here. And so we see that the inferior margin of this interatrial communication is quite close to the inferior caval vein. So we could be potentially dealing with a inferior sinus venosus interatrial communication. And just looking at this, this appears to be larger than most oval fossa atrial septal defects, so a high index of suspicion that this in fact is an inferior sinus venosus defect. Here is the mouth of the coronary sinus, here is the tendon of Totaro, and then here is the right-sided atrioventricular junction. We know those three features form the triangle of Koch. So here is the triangle of Koch in this heart, and at its apex is where we expect to find the atrioventricular node. So we would expect the AV node in this heart to live here. Then we come across the right-sided atrioventricular junction, which does appear to have a 3-leaflet valve, 1, 2, 3. There are direct connections of this valve to the ventricular septum, consistent with the morphologic tricuspid valve. And the ventricle that it opens up into has coarse trabeculations and a septomarginal trabeculation, all consistent with a morphologic right ventricle. And here you can see nicely the septomarginal trabeculation, aka the moderator band. Here's the cranial limb, here's the caudal limb of the septomarginal trabeculation. This is also known as the Y of the septal band. And then here is the right ventricular outflow tract here. It hasn't been dissected. And so we'll turn our attention now to the posterior aspect of the heart and go back to where we were during our little teaser, which is now the other atrium, which is now smooth-walled, consistent with a morphologic left atrium. Here we can see the left atrial appendage externally. Here is the mouth of the left atrial appendage, and we can see that there's all the pectinate muscles are confined within the appendage itself, also consistent with a morphologic left atrium. Now, when we go ahead and open up this atrium, we do see this intra-atrial communication here, which is quite large. We see the right lung right here, and we see the right veins, the pulmonary veins, draining right by the inferior margin of this patch. And this heart did in fact have an inferior sinus venosus defect. And so when this was patch closed, special attention had to be given to making sure that the right-sided pulmonary veins drained back appropriately to the left atrium, and that the inferior caval vein drained back to the right-sided atrium. So here's a superior sinus venosus defect, and there might have been also a concomitant oval fossa atrial septal defect. But it's important to keep in mind that a sinus venosus defect in and of itself is not a true atrial septal defect. It's better classified in the realm or in the spectrum of anomalous pulmonary venous connection, because really it's highlighted by an anomalous pulmonary venous connection from the right-sided pulmonary veins in most instances, which leads to a defect that allows for shunting between the left and right atrium. When we look at the left-sided atrioventricular junction, we do find that there is a 2-leaflet atrioventricular valve with a leaflet here and a leaflet here. There's no direct connections between this valve and the ventricular septum, so all consistent with a morphologic mitral valve. When we look at this left ventricle, or when we look at this ventricle, I should say, we see that there's fine crisscross trabeculations consistent with a morphologic left ventricle. And then when we look at the left ventricular outflow tract here, we find an arterial valve with 3 leaflets, 1, 2, 3. This arterial valve does have fibrous continuity with the anterior leaflet of the mitral valve, all consistent with a morphologic aortic valve. And here we can see one of the coronary arteries arising from within the sinuses of the aortic valve. As always, want to point out that the aortic valve has these half-circle fibrous valvar leaflets. In between them are these triangular myocardial triangles. And so the true annulus of both the arterial valves, the aortic valve and the pulmonary valve, in most hearts is actually crown-shaped or a coronet. It's not truly round or oval in shape, although the round or oval annulus, or what we call the basal ring, is a helpful clinical tool, and I'm not discounting that, but the true annulus of the arterial valves is actually crown-shaped. Nonetheless, that's this heart with an inferior sinus venosus defect.